I hope all is well, and I would like to just wish everyone a happy post-Thanksgiving. This is our medical advisory committee, and we are here today this evening to discuss what's next and how should we proceed and move forward as a school district and as an educational community as we continue to move through our issues with COVID-19. So before we begin, I would like to give us an opportunity to just talk about our current situation with data and where we are with information. And Jamie has been so kind to step in and to share some information with me prior to tonight's meeting. And Jamie, I don't want to take any of your thunder away, but I'll start. And if you have any other information that you would like to share, and Laura, I would also invite you to weigh in as well. I want to share my screen. And what you will see here, I'll try to make this a little larger. Can everyone see? So this is our City of Wauwatosa case burden. And this was as of November 28th. And Jamie, once again, thank you for pulling this data. We'll go to our dashboard in a second. But you'll see here that we are seeing some spikes in infection rates that as you're following the news and information in the media, we're getting a little concerned about some of our infection rates. I had a chance to talk to Caitlin this afternoon, and we're seeing some all-time highs in positive cases among our students. And again, I want to make sure that everyone has an opportunity to weigh in. But I believe Caitlin shared with me that we had about 25 positive cases reported today. So we're seeing a spike again in some of our infection rates, not only within the City of Wauwatosa, but also within the school district. I want to pause and see if either Jamie want to add anything to what I've shared, or if Laura or Caitlin want to weigh in on some of the data that we're seeing.
I have a few slides to share, so if you want, I can share my screen and share some.
Absolutely.
Of Wauwatosa.
Yeah, I'll stop sharing mine. You can share yours.
Okay, can you see that?
Yes.
Okay, there's just a few, but like you just shared, we have our new positive cases per 100,000 residents over, mine's a week earlier, but was about 250. And our 7-day positivity rate was 9.2%. I shared the CDC sort of community transmission levels here to kind of just show where we're at in Wauwatosa. So we're at a high transmission rate for our case rate and a substantial transmission for our positivity rate. This is pulled from the county dashboard. It's a little hard to see, but it kind of just shows the trends of our positivity rate and our case rate since about the end of June. So you can see we were pretty low on both of those in June, and then saw that increase at the end of July, sort of stayed plateaued through August and September, and then started to see increases sort of near the end of October, early November. The top graph here shows our Wauwatosa cases by month since the beginning of the pandemic. So it shows that huge spike in November of last year, and then sort of the plateau over the past few months and starting to see that increase in November. The graph below shows cases by week for 2021. That really shows sort of the spike we've been seeing over the past few weeks. We were really kind of steady around 80 to 90 cases. for the past several months. We saw a slight dip actually in Wauwatosa at the end of October, and then a spike early November. This pulls out total cases by age group. So you can see I pulled out 0 to 11-year-olds because they hadn't been eligible for the vaccine yet. So it showed that they were 14% of our cases back in July, and then all the way up to 29% in October and 27% in September. So that's where we're seeing most of our cases is in that age group. If you look at just cases under the age of 19, it makes up about 35 to 40% of all the cases in Wauwatosa. And then this is put together by the county. It just shows where the cases are being seen for children ages 0 to 17. I sort of put a circle around Wauwatosa because it's hard to see on this map. It's just a screen grab, so I can't really zoom in. But we are seeing areas within Wauwatosa that are seeing higher cases than other areas. And then some vaccination data. In Wauwatosa, kids ages 12 to 17 are 79% fully vaccinated. Adults 18 plus are 80% fully vaccinated. 68% of our total population is fully vaccinated, and then 24% have received either a third dose or a booster dose. We're not able to pull out specific booster data at the local level yet. So we either know that they've received a third dose based on that eligibility criteria or a booster. We can't access kids data yet at the local level, but countywide, 12% of kids ages 5 to 11 have received their first dose. When we look at just the suburbs in Milwaukee County, that's 24%. And because kids are just getting their second doses this week, 0% are fully vaccinated because we need to wait 2 weeks after the second dose before they're considered fully vaccinated. Like I said, we don't have Wauwatosa data yet. Our data tends to be a little higher than some of the suburban data as a whole. So I imagine we're a little bit higher than that 24%. And then this has been, I think, shared before, but when we looked at kids ages 12 to 15, it took about 5 weeks for that age group to become 50% fully vaccinated. And then it took about 5 months in total to reach that 80% vaccination rate. So if trends are similar for the 5 to 11-year-olds, we would likely see about 50% of that age group being fully vaccinated in about a couple of weeks from now, and then 80% fully vaccinated by April 2022. That's all the data I have, but I'm happy to answer any questions that may have come up.
Hey Laura, this is John Nolan. Are you in what you guys are seeing? Are you seeing the younger kids on the same trajectory for vaccination rates as they were for kind of that middle group of children?
Yeah, anecdotally, we are seeing that. We had about 3 mass clinics about 3 weeks ago now, and all of our vaccine appointments filled up really quickly. We're getting a lot of calls from parents looking for where they can get their kids vaccinated. We don't have the data for all of Wauwatosa yet, but we've done over 600 here at the health department.
I had one quick question, more probably for Caitlin. In the cases that you've been seeing, have you been able to, like this with this kind of recent spike, have you been able to elucidate if it's, you know, where the transmission is coming from, that sort of thing?
I mean, over the past 2 days, we saw a larger spike of cases than we had in any other 2-day period. I relate most of that being to people just wanting to get tested before they saw family for Thanksgiving. Most of the transmission, and we just asked parents if there was any known exposures in the previous 14 days. So most of it is still unknown. The second largest category is somebody within the household. Third category is social. So social is anyone outside of the house and anyone outside of school. So it's a very large category that could mean sports, hanging out with friends, meeting grandparents. Those are our 3 largest categories for transmission.
Thanks.
Caitlin, do you have any specific cases of in-school transmission?
We do have a lot of linked cases. Anecdotally, it's usually during the unmasked portions of the day. It's who they're sitting next to at lunch, but we've also found that who they're sitting next to at lunch is also who they're hanging out with outside of school. So because I don't know when the transmission happened, I do count it as an in-school exposure if we can link it in school. Unfortunately, I don't have the exact numbers on that. I was able to look at cases between September 1st and October 23rd, and we were able to link 27 of those cases to an in-school exposure. There are more since then. It's just we've been unable to get those numbers exact at this time.
Do we have any updated data about quarantines, number of people being quarantined?
So between September 1st and October 23rd, we had 150 positive cases. Of those 150 positive cases, 101 were contagious while at school. The 101 cases led to 821 close contacts that were identified. Due to completed vaccination series or to the 3 to 6 foot exception the CDC allowed in schools, we only had to quarantine 475 of those students. Of the 475 who were quarantined, 300 got tested to reduce quarantine, and only 27 of them tested positive. Again, this is only through the start of the school year till October 23rd.
Any other questions? Okay. Thank you to Caitlin and Laura and Jamie for sharing information and data that should always ground our conversations. If you don't mind, I would love for us to pivot and transition to what are next steps. And for those of you who follow school board meetings, you may be aware that the board has asked that our administrative team bring some type of concept or conversation for the potential of relaxing our mitigation strategies to the December 13th board meeting. And so in order to spark a conversation, and this is simply a proposal for reaction from the committee, I would like to share. I'll share my screen. I would like to share what our internal team discussed this afternoon in regards to a potential pathway, if you will. So, and please let me know if you're unable to see the screen, or if you need me to enlarge it. So, in regards to a potential revised mitigation proposal that we would love your feedback on this evening, phase one would include making masks optional for students and staff who are fully vaccinated in high schools. Now, there's a subpoint underneath this that also states mask optional for students and staff who are fully vaccinated in grades 7 through 12. And we want to invite the committee to weigh in on both of these options. We do have the ability to segregate and to separate our 6th, 7th, and 8th grade students. And so we do have the ability to expand the optional mask model to both 7th and 8th graders as well. So that's an area where we would invite the opportunity for the committee to weigh in. Fully vaccinated is defined as 2 weeks after second shot in a second dose series, or 2 weeks after one shot in a single dose series, just so we have definitions down. The second point, masks will continue to be required for unvaccinated staff in those grade levels, either 9-12 or 7-12. Vaccination status will not be provided to our school staff. Only nursing, health aides, and administrative assistants who assist in contact tracing process or immunization tracking will have access to vaccination records. Vaccination records will only be accessed through when determining quarantine, not to enforce mask wearing. I think that's really important for us to identify. Third is to quarantine only when there is an outbreak. The way that the Wauwatosa School District is defining outbreak is defined as at least 2 positive cases with onset dates within a 14-day period in one class. And so that's really important. I think CDC, and it's on page 2 of this document, the CDC actually defines an outbreak as is defined as the presence of at least 2 confirmed or probable cases of COVID-19 in the same school building. And so we're actually narrowing that down and going to class. We would continue to quarantine, or we would continue to honor and enforce quarantines issued by the health department. Masks are required for students in junior kindergarten through 8th grade. And upon board approval, we would start this as early as December 14th. So before I go to phase 2, would love to get feedback on phase 1. Proposed phase 1.
Can I start by asking a question? This is hoping some of the medical colleagues might know this, maybe Laura. So my understanding is that after you get the second dose of your COVID vaccine, that over the 6-month period, your immunity sort of wanes, and that's why they're recommending boosters. But I also understand boosters are only offered to 18 plus, or age 18 plus right now. Is that data driven? Is that like, why, do you know why the 18? And what do we know about 16, 12, 13, 14, 15, like that age group and their immunity status, since they are also nearing the 6-month mark?
Others can feel free to weigh in. I believe that boosters will probably come for a younger age group at some point, similar to how we saw other younger age groups get approved over time. I think we're still waiting to see sort of exactly what the data says around lasting immunity, especially when we introduce the booster. It varies by vaccine, it varies by booster, it varies by new variants. Hopefully, vaccines will be effective against the new variant, but that remains to be seen.
I guess I'll chime in. I kind of have a hard time at this point saying that I would sign on to or would be in favor of this phase 1 when we're in a point where we're spiking again. I mean, and that still does fly in the face still of what the CDC is recommending, which is in areas of substantial or high transmission that all individuals inside an indoor facility should be masked. I'm fully aware that there are a lot of places where that does not happen. But I think right now, when we're kind of where we're at and things are spiking, and we still are in that point now with the Omicron variant that we don't really know what to expect with Omicron, I don't think it would be very wise, at least not this early, right before we kind of end the semester, to start going mask optional. I just don't think we're in the right spot to do that yet. I wish I could say otherwise, but.
No, I agree. That's why we're here. We are seeking feedback.
I would agree with that. And just to speak to quarantine specifically, there is a state statute, it's 252, that requires schools to notify the health department of known or suspected communicable diseases that includes close contacts. So I always have to refer back, if you're going to make a change to quarantine, make sure you're discussing it with your legal department, because it does open you up to going against state statute.
Dr. Means and Dr. Jessup Anger, can you maybe speak to why the school board is, like, why are we considering this now? I guess is just knowing, as AJ mentioned, all of the reasons why we're in a higher risk period. Why now are we talking about going against some of the science or the bigger group recommendations like the AAP and the CDC?
Dr. Means, I can, and I would say I would speak only as a school board, a single member of the school board. But from my perspective, very much a desire, recognition that masks have an impact on students and sometimes on their learning. So certainly a desire to have students out of masks as soon as it's advisable. My thoughts from the beginning of the school year is number one goal for the year, keep as many kids in school as many days as possible. When we talked about this as a school board, I think almost 3 weeks ago now, maybe even 5 weeks ago, things have changed since then in terms of caseloads, in terms of other things. So I think it's important to always be kind of asking these questions. It doesn't necessarily mean that it's something that we're, that I am or we are individually or collectively pushing for. But I think we want to make sure that we're calling the question and moving forward with this question on an ongoing basis. If for me, as a school board member, if we would be greatly increasing the likelihood of increased cases, increased quarantines, losing more students 2 days in school, that would be really problematic and would be a really good reason for me not to vote in favor of removing masks at this time.
Thank you, Eric. Jenny, I would just echo what Eric shared. I believe 3 to 5 weeks ago, we were in a different place, and I believe the board was doing their due diligence to at least ensure that administration was thinking of other options, and we're not in a place where we were simply going to keep the course steady when you consider the circumstances 5 weeks ago where we saw infection rates dropping. I think, as everyone has stated thus far, circumstances have definitely changed. And on the flip side, in defense of the board, I think their job is to continue to push us administratively to make sure that at least we're considering options. I think we're also, and I shared with the board that our process is one in which we bring these proposals to this medical advisory committee for you to do what you're doing this evening, which is to say either it's medically advisable or it's not, because ultimately you are the experts that we rely on. So that's just a little bit of logic of how I understood the request for additional considerations to be brought to them. But as Eric stated, I think the circumstances have changed a bit since 5 weeks ago.
It's the first time I've operated one of these microphones, but I will jump in here. Tim Richer here. So I guess I like Dr. Jessup-Anger's approach to this, and I raised this question to the board a few weeks ago. I think for me, it really comes down to what our goals as a community are and what our goals are as a district are. And then it's our job to, as an advisory committee, help advise in a way that allows the community and district to achieve those goals. So for me to sit down and look at a sheet of how we're gonna start to take away masks and stuff is sort of like the answer before the question for me. if the goal, if we agree on and the community agrees on by virtue of their elected representatives, but if the goal is, to Dr. Chesapanger's point, is to keep as many kids in school as possible, then the answer will never be take away masks, ever. If the goal is to, that's achieved by two ways. That's by keeping kids from getting sick and testing positive, of course, and then trying to minimize contacts and everything that we've been doing, right, fairly successfully. And we saw the same peak last year. There's articles now about the seasonality of this and whether or not this will be a trend continuing. So I suspect if 2 years is a trend, that every November we'll be faced with sort of similar questions. My question was a couple weeks ago is, then if that's the goal, because I actually do think last year the goals were different. I think last year the goals were to not get kids sick and to keep the community healthy and not contribute to a greater COVID problem. And keeping kids in school as much as possible was at best like a tertiary goal, at least physically present, I should say, in a classroom. So hearing that the goal is to keep kids in school as much as possible being the #1 goal this year is a change of course. And if I'm stating that correctly.
Dr. Richer, I would individually disagree with that.
Okay.
I would say for me, certainly as early as December, the goal was to get and keep kids in school as much as possible and to balance that against health and safety. But again, 1 of 7.
Yeah, right. No, I agree with that. I guess I should have pointed out that the timeline, it's not that there's a change right now, but there was a change at some point, you know, in the goal. And there's 2 ways to achieve the goal of keeping kids in school as much as possible. One way is to do everything that we're doing and absolutely bottom out illness and continue to contact trace. Or decide, and again, I'm not saying this should be policy, but the other way to keep kids in school is to stop asking about COVID. And tell kids when you have a fever, stay home. When you feel ill, stay home. When you feel better and you feel like you can contribute in a positive way to your learning, go back to school. The old rules, as one might know. Those are the only 2 ways to keep kids in school, as I see it. So it really comes down to a question of what the community wants. And if minimizing, if we're going to continue to test and keep COVID at as low as possible and do all the mitigation that we're doing, then there's no way to do that by taking masks away. The only other way to achieve it is to stop asking people to test when they get sick, and stop asking them to give that information to schools, and stop asking them to provide everybody that whom they're around, and to stop contact tracing. If there's a third way to keep kids in school, because I may be grossly oversimplifying it, but it's either keep them healthy or stop caring, and stop caring, it's oversimplifying perhaps, you know, the reality of it, but it's to stop testing, stop the aggressive testing, reporting, and contact tracing, I guess is a more perhaps educated sounding way of putting it. That's the only 2 ways I see it. So when I see mask decisions come up, to me, masks are a great way to, imperfect, but a great way to keep kids healthy, not just from COVID, but a lot of stuff. But that's sort of a secondary consideration for me. For me, it's not about mask use, yes or no. It's about goals, and if you're asking us as a committee to keep kids as healthy as possible and in school, well, then doing it the way we've been doing it is probably the way to go. There will always be variance to AJ's point. But I just feel like coming out with, hey, here's how we think might get rid of masks is seems a little bit backwards to me.
I'm assuming this is,
with you, Dr. Justin, as you know, back in January.
just to add to that, I'm assuming in your first option, vaccination is included in that, but I just want to emphasize that's a huge way to keep kids in school. Fully vaccinated kids are exempt from quarantine and kids don't have to quarantine, so that'll help keep them in school as well.
Yeah, exactly. That's the good news. I mean, we might be finding ourselves with far less focus on this problem every month that goes by. I'm hoping that your 5 months is grossly over. I think that's way too long. I think it has the potential to certainly move faster with this younger age group. Hopefully first quarter, maybe we get even a younger group on board, because as we all know, there are kids as probably as young as 3 or maybe even younger in our school. So it'd really be nice to get them on board. So this all may be a moot point. But I think that there's also, we all battle this idea in the community that once we're all vaccinated, that we're not going to see virus transmission anymore. And of course, it's just not true. The virus will continue to be transmitted even amongst vaccinated people. Although it might seem, I wish Leslie were here, but it seems to me like it seems to be less the case in vaccinated kids and vaccinated adults. But yes, vaccines might make this all a moot point. But we should point out that we will still have COVID in schools even after everybody is vaccinated.
I see Dr. Nolan's hands is raised.
Yeah, I appreciate everybody's comment.
Your connection's really choppy.
For me, this is really a two-part question, I believe, that you're asking us. And the first part is I'm sorry, can you guys hear me?
You got a little better there at the end.
Can you guys hear me at all?
Yes.
Can you guys hear me? No. Yeah. Okay. For me at least, I think this is a two-part question. And the first part is, when we do scale back our mitigation strategies, which we will at some point in time, is this what the district just presented to us? Is this a good framework to go about doing that? And that's one question. And then the second question is this the right time to do that scale back? Is it the right time to start to lessen our mitigation strategies? Because we will do it at some point in time. For me, the first question, when it comes to masks, the optional masks for fully vaccinated students and staff is probably the right way to go, for sure. Whenever we start scaling back our masks, making those optional for the fully vaccinated folks is probably the right way to go. The quarantine thing, I'm not 100% sure on. I would have to think about the quarantine thing a little bit more. And I think Laura brings up some good points as far as state regulations with quarantine and CDC guidelines for quarantine, in the different definition for outbreak. I have some questions about that for sure. In the second part of the question, is this the right time to do it? I think everything that we saw beforehand, all the data that we saw beforehand, I mean, we can probably do it at any time we want to, but we don't have any data to say, hey, now's a really good time about doing this and everything. And this needs to understand that there's no data or accurate mitigation strategies, but that's kind of it. Number two, is this the right time to actually enact that plan? I'm not sure if you guys could hear that at all. Hopefully you could.
It was a little chopped up at the end there, Doctor. I lost you at least when you said, is it the right time? And I think you were going down a very interesting intellectual conversation of, but when is the right time? And what statistically will tell us what's the right time? And so if you want to just maybe revisit that stream of thought.
Yeah, I mean, it's not a lot different than last year. Anytime we made steps forward, we waited for a downturn. in our case numbers and in, you know, how much transmission was going on in the community, because we wanted to set ourselves up for success. And I don't think, in my mind, this wouldn't be any different necessarily. I don't think there's a certain number you can pull out to say we need to be at 150 cases per 100,000 or anything along those lines in order to start this. But to do it as case numbers are rising, it's hard to get behind that. So I don't know if that clarifies it a little bit more.
It's crystal clear. That's great. Thank you. So, I don't think you have to push it.
Hi, this is Sonia Phillips. I'm the social worker here in the school district. The difference for me, and I'm not a medical person, but the difference for me is that at the time, the reason why I felt like our mitigation was the way that we did things, the way that we had masks, and why that's different than the rest of the community, was that nearly half of our population didn't have the opportunity to get vaccinated. And so for me, I wonder how that changes when the vast majority of the people in our buildings have the opportunity to be vaccinated, and if that's a game changer for anybody else. The second piece is a bit of a comment that's not in your phases, but I feel is really important for the school community, and that is beyond mask is the gatherings. And so a lot's coming up right now, and it's opportunities for celebrations, opportunities for concerts, that sort of thing, rallies. As an example, I know Wilson does a Harry Potter month, and so lots of different little celebrations, and everyone's kind of hesitating and putting it on hold. But those are things that bring joy and culture to the schools as well. And so the other question I would have is there a chance to increase the gathering if we kept masks on?
Sure. And again, I'm so thankful to this group and will continue to trip over myself in thanking you for your expertise. But it's, and when I talk to colleagues in other school districts, one thing that is really emphasized, and when I talk to parents, they believe that there's a social emotional impact that's is impacting kids. And it's as simple as seeing the water fountains, or as we call them in Wisconsin, bubblers. Seeing those just prohibited from students, that does have a cumulative impact on your psyche. I know it does for me when I'm in the buildings. I'm starting to get emails and questions from parents around, help me understand why elementary band, orchestra, and choir concerts cannot happen, but we're seeing some of the secondary ones happening. And it's a time for gathering. I know that a secondary or tertiary goal, because I love Tim's, the framework of what are the goals of the educational community, which is the foundation of our strategic plan currently. One of those, at least tertiary goals, was always to bring back our community, bring back the ability to gather and to become one again. And I just speaking candidly, I know that our building principals are really in a frozen state. They're in a frozen state because they don't know if they should host and encourage these gatherings or if they shouldn't. And they're starting to get pushback from their school communities because parents are coming in and saying, well, I have friends or I have relatives in school district X, Y, and Z who they do have different goals. And they're getting their kids and their families back to a level of normalcy. And here we're not. And so help me understand. And so the principals are now frozen and not understanding what they should do. And they're seeking guidance from the district office, and we're unable to provide the type of direction that we would like to give them. And so I add that not as a counter to anything that's been stated, but just maybe inside baseball in terms of how it's impacting school operations.
Dr. Means, one thing I would add, I know the Roosevelt holiday concert was got an email that it was going to happen via video this year. And these are things that I think you and I spoke early in the year, that my strong preference is that all those things that would build community, we would maintain. And if that means that we were in masks, then I would be fine being in masks. Particularly if we can have those things as whatever mitigation we need to be able to bring the community back together to the greatest degree possible. So I thank you for that question. And I think I would love to, whatever we can do, I would love to be in that place and would love the medical panel's kind of perspective on that.
Are those
Yeah,
things?
so primary. Oh, go ahead, Jenny.
Oh, I was just gonna ask, because I don't know that that is something specifically we have ever said no to. I don't recall us having a conversation saying no school concerts. I do remember that there was a presentation somewhere along the way of sort of what phase we're in, or there was, I can't remember how it was staged. I don't remember what terminology was used. Can we, does somebody have that document? Can we review that document?
Jenny, I think you're speaking of the reentry plan itself.
Yes, I think that's what it was called.
Sure. And I think you're speaking of maybe the different levels that we were at. I think we're at level 3 right now. Let me try to, I'll pull it up as.
Okay.
Yeah, comment too.
Yeah, I'm trying to share it.
No, I'll share my screen. Thank you. Okay. So.
And I think I misspoke. That was that Sonia who raised this question? Thank you.
Is this the document we're speaking of?
Yeah, I do think this is the one.
So we're currently at level 3. And when it comes to large school events, it states that large school events are allowed based on individual school infection rates while maintaining 3 feet distancing. I think some of the elementary school principals would make the argument, well, it's difficult to host our events in our schools and maintain 3 feet distancing. The pushback good pushback, really good questions that I'm starting to get from parents, which are thought-provoking, and I've presented them back to my colleagues who are saying, never thought about it this way. The pushback I'm receiving from parents are saying, well, wait a minute, you've known we were going to be in a COVID environment when school started September 1st. You also knew that these school concerts are really important to Eric's point. They're really important to our school culture. Why didn't someone on September 2nd at the elementary level book Wauwatosa East, Wauwatosa West, Longfellow to host the Roosevelt concert, for example? And I don't have a good answer for that question. That is a fair question because it goes back to Tim's question of, so what's our goals as a community here? And I think we've always articulated that one of our goals was to have these large school events if we could. There's nothing preventing us from having those events. I went to 42nd Street, the performance at Tulsa West. We were distanced, we were masked, and it worked. So I think there are ways that we can move and still function in this space. I love the way that you framed it, Tim. I think we're going to deal with COVID-19 for the next 10 years or more. And how we, to Sean's point, when is a good time to implement reduced mitigation strategies it should be on a downward trend. We should be able to see the downward trend of data. We're not seeing that right now. But I believe, to bring it full circle to Jenny's original question, I believe the board asked administration to come back with some type of suggestions, because we do need to start thinking about what that framework looks like. And maybe the time isn't in December or January, but as a board, they have to start, they being the governing board, they have to start giving the community some type of end goal. They have to give the community a next phase of discussion of what this looks like. And I think that's how we landed here. Sorry for the long explanation.
I would personally, again, you're weighing different types of health here, physical and emotional. And if we're gonna start picking things apart, I totally agree. I would be totally in support of giving up a little on the physical risk side for the mental health benefit, whether it's school concerts or prom, where the moment they leave the building, it's going to be prom anyway. Really, it's the only social institution in town anymore where you even have to wear masks, frankly. And again, I'm never one to say, well, we need to be like everybody else. We need to define for ourselves what our goals are. But when it comes down to the return on a community event like that, I would totally support, even without 3-foot spacing, frankly, mask use by everyone, like every other, concert stuff. It's a tricky time, though, to Sean's point. We had this peak last year, but it's a little later this year, just slightly, by about like a week or two is what it feels like. So we might not have that trend down prior to the holidays. I'd have to see the curves to remember exactly. I'm not sure we're going to have the downward trend in time, for holiday or winter gatherings and whatnot. But we should, as best we can, I think, rely on last year's trends and stuff to perhaps dictate other events that are coming up, certainly in fall, or in spring. Anyway, long-winded way of saying mental health, I think, far outweighs the risk of those types of gatherings, even at less than 3 feet, in my opinion, especially as more and more are vaccinated.
I think there's sort of like two separate issues. Issue one is, can we, what should we do with masking, which is definitely a bigger issue, but also in my mind has much less social or emotional negative impact. Wearing a mask for the vast majority of kids is not a detriment to them. Missing out on important school-related, cultural-related activities is probably a much more detrimental thing. From everything I can see in our school reentry plan and where we're at, we would support that, but there probably does need to be some thought put into it and some additional modifications made, as I think most people have done perhaps in their personal lives as well. Is we'll still have Thanksgiving, but we'll do it in this way different than another way. I do want to be thoughtful that school Christmas or holiday concerts are happening before the holiday, and if we're putting people at higher risk, I just want to be really thoughtful that people may miss plans related to their holiday that they may be thinking are very important to them. I know there were a number of people who were exposed around right before Thanksgiving and were very angry and upset that they had to miss their Thanksgiving plans. So I just want to be thoughtful that we would potentially be increasing risk around a holiday when people would be having a number of plans in place.
Thank you.
I agree with what you were saying, and I might be overstating this, so, correct me, mental health professionals, if I'm wrong, but it feels like there's this idea that we get rid of masks and a lot of our problems are going to be fixed. And I think that's not true, because we've been in a pandemic for almost 2 years now, and these kids have been through so much. It's going to take a lot to get back to any semblance of normalcy through mental health, education, social skills. That I don't want to overstate that masks are important for public health and are not going to solve all of our mental health problems.
This has been great. May I ask a question of this great group? Sean made a statement that I thought was really helpful, which is if we break up, I think Sean and Tim are giving us a really good framework. The first is, what's our goals? And I think that's a fair question to not only ask this group, but then bring it to the board and ask. I think Eric said it well, he's one of 7, but what's our goals again? And then the second portion of it is that 2-part question that Sean phrased, which is, so I love the way that he said it. Let me go back to it. So what's the framework? Is the framework that's in front of us that we propose, and we want you to put holes in it, is this framework the right framework for us to consider? I think we've all established that maybe the timing's not right based on the upward trend that we're seeing, duly noted. But is this the right framework for us to start from? Because if I'm doing my due diligence for the board, they will want to know, at a minimum, is this the framework that this advisory committee can get behind? Maybe the timing's not right. But is this at least a good starting point for a conversation?
I would need way more time than tonight to
Sure.
land on that.
That's fair.
I would need a week to wrap my head around even phase 1. It just seems like a lot of work and a lot of gray zones. Who's going to have access to vaccine records and all of that? And then when I hear that, like, oh man, that's things. It's very tricky very quickly. Sure. So I personally would need. I don't know how much time. I don't know what your deadlines are for the board. Probably much. We need 1 day. I don't know. But I would need a little bit more time. Maybe we could. I don't know if we would be getting back to you as individuals, or we would want to, meet again in a week or something to bat this stuff around. But
a great suggestion. And anytime a proposal is being provided to a group, you do deserve time to chew on it and to really analyze it. I don't have a hard deadline. I think the board would like to have at least an update. If this group is willing to come back together in a week, that would really be ideal. But I also I know people are very busy and don't want to put demands on schedules that are unreasonable.
Laura, can I bug you with one other question? Somewhere in here, there was a statement about we would still defer to Tulsa Health Department on quarantining and whatnot. So would that really just that would supersede anything that the district would do, right?
Yes, it can get complicated because you've seen schools who have decided not to quarantine and they've made that decision, and there hasn't been a lot of lawsuits that have come down or public health orders. There are a few options. So right now, state statute does require the school to do disease notification to the health department when they're aware of disease in the school, and then provide those close contacts. That right now is done basically on a voluntary basis. If schools decide not to, it does open that up to like the health department writing or specific orders for individual cases and close contacts, and then they would be required under law to follow those quarantine orders. Does that answer your question?
I'm probably slower than almost everybody in this group. It would be really nice to be able to read that just sort of be able to wrap my mind around that.
Yeah, I can send the state statute. It is very legal. So
Don't send that. That's even worse.
Yeah. But I can try to share a summary if that helps.
And I just want to jump in here and talk about the rationale for making a slight change to the quarantines. Students do not want to rat their friends out. When we contact trace with students, we give them the definition of close contact in an age appropriate way. And we ask them who meets this definition. And last year we saw high schoolers, we know they were lying to us. They told us, oh, I didn't eat lunch with anybody. I never hang out with anybody. I was always 6 feet away from everybody. This year we're seeing it happen in younger and younger kids. Kids are afraid. They don't want to keep their friends out of school. It's impacting the child who's sick to know that they're the reason their friends have to stay home. I don't know all the ramifications that's happening for them socially, but you can hear the fear in their voice. They know how sad it makes their friends. So we're not getting accurate information when we are contact tracing with the individual. We also recognize that this school year, students are moving about the school environment like it's any other year. They're not staying distance. They're not staying in their seats. They're interacting with each other, which is what they should be doing. So we have found that seating charts are not always 100% accurate. And it really shows in the data I said before, of the 821 close contacts we had in the first month and a half of school, only 27 tested positive. So we're just looking to redefine our guideline to initiate contact tracing and initiate quarantines, because what we're doing right now is just not effective. And it's not that we don't want to stop the spread of COVID. We don't want to throw our hands up in the air and say, it doesn't exist, we're not going to do anything. We just want it to be more effective and actually meaningful. We don't want to keep kids out of school when it doesn't mean anything.
Caitlin, is that in here? Is that, or Dr.
No. Oh, we can put that in.
Yeah, because I think another option is that it's, if you test positive, you stay home, for the required amount of time, but another sort of halfway point, since we're talking halfway points with masks, I might as well throw it out there. Another halfway point would be, if you're known positive, stay home. If you have symptoms, a certain number of symptoms, Caitlin, you should be tested to prove that you're in school, and then not do the contact tracing.
Or in other words, a test to stay model.
Perhaps, yes. I mean, you have your testing sites going up, or some type of loosening of quarantines. I mean, you're talking about 475 quarantines through the 1st of November. I mean, that's 4,750 missed days of school at best. Or, well, no, I guess if they tested on day 6, they could be back in a week. That's still a lot of missed school, and that's a lot of missed school. So, I think, again, I need time to think about it and chew on it, but I think another halfway point is stay home if you have COVID, get tested if you have these symptoms, but we're not going to contact trace anymore.
It's just what we're doing with contact tracing, the information, how we're gathering it, we're just not getting good information. And like Laura said, it's all on a volunteer basis. It's all on what people want to say. And I can't go and say, oh, hey, Susie told me that you sat next to her, so that's why you have to go. Like, I can't verify the information with the people I'm sending home because that breaks confidentiality. I just want to make sure we're honoring and actually doing things that matter. And I don't want to keep kicking kids out of school.
And I know that our school nurses won't say this, Caitlin and her team won't say this, but I think the thing that I'm even more concerned about, just full disclosure, more than I'm concerned about COVID, is that they're unable to do the other normal school nursing services that kids need them to do. They're constantly 100% of their time devoted to being COVID-19 administrators, if you will. And so we have a myriad of health needs that school nurses attend to that they're unable to do right now. And so when we talk about the risk reward of what's happening in our schools, that's another component of we have paralyzed our school nursing team to, in essence, just serve one sliver of public health that's impacting our schools. Not to minimize it, I don't want to minimize it at all, it's very important. But we're seeing diabetes on the rise in our schools. The model that we currently have where we have to depend on our school nurses to support and provide professional learning to our office aides, that's going unattended. There's just a lot of different things that are slipping through the cracks because of our diligence to either contract tracing or following up on possible cases. It's impacting the schools.
I would be able to vote 100% positive on that hiring that administrative assistant. And I do not have need any time to chew on, by the way, for the nursing team.
Thank you. I know they would appreciate that. It's been a long haul for them. I've really been very appreciative of their service.
I just want to say, since this is a recorded meeting and I don't know how many parents are watching, we are still keeping the kids safe. We are meeting their needs. We're just, it's like we all have two full-time jobs. I full-time do COVID and I full-time take care of the needs of students. It leaves us very stretched thin, but the kids are still safe in the buildings.
Thank you. Yes, they are. Please excuse my advocacy for the school nursing team. I don't want to give the impression that they're not addressing all the needs.
If we're gonna have a little bit of time to look at this new proposal, could we also get some of those numbers again broken down about how many kids were contact trace positive, and it like to break it down by like 12 and up and 11 and under, from like who had access to vaccines, how many days are our older kids missing versus our younger kids, presuming that we can then make some predictions about what will happen in the next 2 or 3 months as our 5 and ups are also vaccinated, and we can kind of predict number of days they may be exposed and missed based on vaccination rates.
I can do my best to gather that information. The data I shared was only through October 23rd. I just haven't had a chance to close out cases and gather the information to current date. I will tell you, based on and through early November, at the time, I believe it was early November, this was last updated, we had 291 cases within the district. 168 of those were in the elementary buildings. We're definitely seeing more cases 6th grade and under right now. Last year, it was all at the high schools. So it definitely has flipped.
So if we followed that same trajectory of the older kids with the younger kids getting vaccinated, presumably cases go down in the schools. Certainly number of people needing quarantine would reduce dramatically.
Yes, through fully vaccinated and just through less spread in our schools, it would reduce the number of quarantines.
Okay. And is there a way that we could, is there any kind of voluntary basis or anything we could do that would ease some of that contact tracing? Like even to be able to say at the elementary level, someone in your child's class tested positive. If your child is fully vaccinated, send in your records now. And then you can like eliminate however many kids out of that classroom that you need to contact trace. Are there any things like that that we can do that would make anything easier that you would be able to keep on file?
Unfortunately, we've brainstormed a lot of different ways to make things easier. I gotta say, most of our principals do help extensively with the contact tracing, and honestly, sometimes it's the kids themselves that contact trace. So we've definitely used all of our resources. It is time consuming, but to do it correctly and to maintain confidentiality, I don't know that we could enlist any additional help. It's just time consuming to do it right, to make sure it's done correctly. But like I said, even if we're doing it correctly, the information we're gathering is not necessarily accurate. And I am more than happy to contact trace all day if the information showed that it was making a difference. To know that only 5% of the kids I sent home, or that kids that were identified as a close contact, tested positive, it's really disheartening, because it says we're either not getting the kids or it's not spreading in our buildings as much as we thought it would.
Well, that's what I'm wondering is maybe that's actually not disheartening. I guess it depends what way you look at it. When I hear that, I hear, oh, the mitigation efforts we're doing are really effective and we're stopping COVID.
I guess what I say is disheartening is the knowing I sent kids home and I made them sad.
Oh.
That's what's disheartening to me, is knowing that they didn't get to stay with their friends in school and have that in-person learning experience.
Sure.
Kayla and I have talked a bit about this before, and I'll probably always push harder on quarantine because it's my job to uphold state statute. But I would like to see, instead of changes to contact tracing and quarantining procedures, look at alternatives. So number one, encouraging vaccinations to keep kids in school that way. And then it was mentioned like a potential test to stay program. This is being piloted in some other communities, so it hasn't been necessarily given the stamp of approval by DHS, but it's something that we could look at for potentially in 2022, where if somebody is, identified as a close contact, they get tested, and as long as they stay negative during their quarantine period and asymptomatic, they can stay in school. So I would much prefer to see something like that, where we're, keeping kids negative, keeping them in school as much as possible.
May I make a suggestion or offer a suggestion? And the suggestion is around giving this advisory committee time to sit with the proposal and to reshape it. In a way where it is still medically sound from a framework standpoint. So let's start there with Sean's question of, is this the right framework? And so let's at least agree there first. Then the second job we have is to talk about, again, our goals or the goals of this committee. Because I think the committee, you've been asked to give us guidance, but it should be guidance around certain goals that we deem important. And I think Eric did a great job in stating one of the goals that I know we all share, is that we want to keep students in school 5 days a week in person. What are maybe a secondary goal or tertiary goal that we want to look at as a committee? So that will be task number 2. And then task number 3 is to agree that it's not a specific number, because we're not going to be that finite, but can we agree that when we see what we deem to be a downward trend, then that is the time for us to consider the revised, reshaped framework that we'll come back and talk about hopefully in a week. Are those 3 goals, 3 tasks that we can all agree on that we should try to shape and to frame? Because then if we can shape those 3, I can take something to the board on December 13th. We may not be able to implement December 14th, but at least now we know what the framework is. We know what the goals are of this committee that we're recommending that not only the board, but the community adopt. And then we also have the ability, now people can look at our COVID dashboard with even greater interest now to say, oh, we're seeing a downward trend. Now that's when we trigger the framework. That feels like if there are people in our community who are in need, and there are a lot of not only parents, but candidly educators who need to see the light at the end of the tunnel. They need to know, when can we make a pivot? That framework of those 3 things, I believe, give people hope. It gives people what's the next step, that we're not just constantly in a state of wearing masks forever, but we can see what's ahead of us. We know what our goals are, and we can get there when we see a downward trend. And Laura, you did a great job in saying masks are great. Don't forget vaccination, because if you want to get closer to that end of the tunnel, help us get there by vaccinating. So I want to offer that to the group to see if you agree, if those are reasonable next steps.
I have one question. So when we met for the school year, we put together that reentry plan, which included some metrics. So it was a community level and an internal level. Are you looking for different metrics than that to make that change?
No,
So I guess what are you asking for, and in what are we looking at value wise? When do we make that change?
I would suggest that when we see a downward trend in either internal or community infection rates. But what we saw and what we heard today or tonight during our meeting, at the beginning of the meeting, not only are we seeing an upward trend in the community and also in Milwaukee County, but you heard from Caitlin, we're seeing a spike over the last 48 hours or so of more positive cases as well. So all the trend lines are going up, and they're not going down. So to Sean's point, this is a reasonable conversation to have if the numbers are going in the opposite direction. We're going in a negative direction that we don't want to run toward.
I guess I think if we're going to consider a downward trend as our time to make masks optional, I would really like to see us define what a downward trend is and how long it has to go on for. I think we talked about this last year when we were considering returning to school full time. We talked a lot about how long does the downward trend have to go on for, if we're at very high or extreme, whatever the highest level category is, if we're at that level and we turn down for a week, is that really meaningful to the community or the safety? So I think I would like to see us define that a little bit more. And then just sort of related, but not quite exactly related to what you were just talking about, Dr. Means, is, I think I'd emailed you and maybe Laura about how can we as a district encourage more vaccination? I'm sure there's a part of this. I'm sure there's a part of vaccination that is hesitancy, right? And so, we handled that differently than we would access. But I have to imagine that a great deal of of people who are not vaccinated is an issue of access and having a difficult time trying to figure out where to go. And I can say particularly for the 5 to 11 group, having kids in that range and trying to get an appointment and waiting in line. And we had to travel down to like the airport to get our appointment. Like I imagine there are families that are, they don't have the access to some of that. And can we do something as a district to make that easier?
We will be a testing site on December 15th and 16th for all ages, for students from age 5 to 11, but we will also offer boosters for adults and for any students between the ages of 12 and 18 who haven't been vaccinated. That's going to be available as well. So December 15th and 16th, we are a whole site for vaccination opportunities. So I'm really pleased to make that announcement this evening. Dr. Nolan, I'm not sure.
Yeah, can you guys hear me? My reception has been somewhat spotty for sure.
It is very clear, sir.
Excellent. So to your point, Dr. Means, those three questions of, is this the framework to use to go back when we start to kind of pull back on these mitigation strategies? And then the second one of defining our goals a little bit closer. And then the third one of, is downward trend good? And how do we define downward trend? In my opinion, I think that's a great way to start moving forward from where we are right now, for sure. To echo what Laura brought up, I'm in the car right now, so I apologize, but I do believe the framework that was already established at the beginning of the school year does kind of define some of this with numbers, and its case number, external and internal case number, like community and internal case numbers. And I don't know from a board point of view and I guess I shouldn't concern myself with that necessarily. If we voted on that before or endorsed that before as a panel, would we need to kind of live within that framework still going forward? Would be a question that I have, and I think Laura brought that up, and I think that's something that we'll have to kind of discuss going forward also. And then, yeah, that's it for right now.
Great points. Thank you.
You could resend.
I'll resend the reentry plan. So we can all just get used to that again and look at it again and revisit it.
Well, you bring that up. I did have one, a third thing I totally forgot about. I'm sorry.
Sure.
To Jenny's point, to define downward trend. We did it very specifically last year with the scorecard that we had with the 4 different tricks that we were following, and we picked to define that downward trend, and we defined lots of debate back and forth. I think we saw 2 cycles of virus community of like a classroom or something along those lines. It was 2 virus cycles because we were using a 10-day time for one cycle at that time. I don't see there nothing in the data or the science that I know of has changed to make that not an accurate way to define downward trend at this time.
Thank you. We lost you a little bit there, but I think I'm going to try to summarize what I heard you say, Dr. Nolan. I think I heard you say that there were some scorecards used last year, that there was a framework of a 10-day cycle that was utilized to softly define a downward trend, and it's your counsel that we continue to use that as a framework.
Well, we wouldn't use the metrics just because we're not following those metrics, at least the 4 that we were last year. But as far as a time frame of a downward trend, still using that kind of 20 to 25 day mark would still be appropriate in my mind.
Thank you. That's awesome. Thank you.
Would we also want to or need to consider what we define as a time where we would return to masks? That's not something we have ever talked about, I don't think, because we've been pretty solid in that as a mitigation strategy. But with the new variant, whether it's the new one that everyone's talking about, or there are new ones that come up in the future, do we want to have some definition of when to return to masking if we hit some threshold?
Yeah, I've thought about that too a little bit, Jenny, and after trying to think it through, I thought, well, as soon as we as a committee, I mean, I think we've always said if one of us stumbles into some data or that is suddenly might change our course, then we just have to bring it up. Suddenly data comes out, because I think it's gonna be hard to predict or set numbers for when you would like use Omicron. I mean, nobody really knows like if there's going to be a change in severity or what transmissibility is. So we're all just sort of waiting on that data. And obviously most people here are like, as soon as it comes out, we're going to know. And so I think that's going to be hard to define because the variants are all going to be sort of different from one another in one way or another. So it almost has to be like when this committee sees or reads or as a group feels like, hey, I think we're going to have to really respect this point. So I'm not sure how you would define it, but at the very least, it has to be something along the lines of, when people on this committee start to get a little scared, I don't really know how you define that, but it needs to be something more, it's just going to be hard to define because the variants are just going to be different from one another in a set of ways that we won't know. So Jenny, I agree, it's a great question. It's just, I don't know how you set a number on that,
I mean, would we not follow the community mandates? Would we
Those
not
are-
match more closely with the community?
Those might be slow. That's all. It seems. That's, we're gonna be able to move a little faster.
Does it put us in a position to go with Dr. Nolan's recommendation of that 20 to 25 day timeframe? Does it, because one of the agenda items, the last agenda item that I wanted us to discuss this evening was the frequency in which this committee continues to meet. At least for the remainder of the school year, does it then put us on a frequency or some type of routine where we're meeting every 28 to 30 days? So now we have the trend of the 20 to 25 days to monitor. And at least until the end of this school year, to Jenny's point, we have a touch point. And now it's not about someone from the committee having to raise a flag and a concern, but we are on a cadence where we are checking in, we're truly monitoring the trend, and it's being addressed and monitored in a more deliberate way. Would that be the answer? Sure, I don't know. I think Jenny's raising a great point. I think, as I'm listening to her and I'm listening to Sean, maybe that's a responsibility of the district then to create a pace and cadence where this committee doesn't have to raise a flag and shout loud from the mountaintops, but we're in a pattern where it's being monitored at least until the end of this year. And then around May or June, we will have enough of a data trend to have some conversations about what do we want to look for in the summer, because now we will have 2 summers under our belts of data. And then we're going into that next school year with a foundation.
I mean, I would certainly be in favor of us having a specific cadence of when, like how often we're going to be meeting so we can plan ahead for things like that and be able to monitor over time. I think my biggest concern is what I've seen happen in the community at large is that, like, when the CDC changed their policy about masking after vaccination in the summer, when everything changed, nobody went back to masking or very few people went back to masking, despite the fact that the CDC has completely reversed on that ruling. I don't want this, unless this is what this people are wanting, I wouldn't want us to fall into the same trap to say, this is where we're at now. Once this mitigation layer is gone, it's gone forever. Unless, again, that's what the district wants. But I would say as a medical advisory board, we're not here to decide what you all want. We're here to give you medical advice.
I think we have a direction. So I guess the next, well, I see another hand raised. So Dr. Nolan?
Sorry, I forgot to take it down.
Sean, Tim said you were just asking for a high five. So.
I always offer for people to give me encouragement.
Yes, it's always important. May I ask, is it, and I know this is a really big ask, and so I apologize. Is there any way we can get back together next week, Tuesday at 7 p.m.?
Yes.
Yes.
We have 2 yeses. 3 yeses. Does that work?
I can do that.
Thank you. Heidi?
Yes.
Sonia? Okay. We will post for next week, Tuesday. We will be very deliberate with our time because we know what we're trying to answer and address. In between this time, I will share the Google Doc with everyone so we can collaborate together around the different thoughts we have around this framework. Again, our goal is to really solidify the framework. Our goal is to develop our medical advisory goals as it pertains to COVID-19 and what we're trying to strive and what we're trying to accomplish. We're going to also define what is a downward trend. We're going to solidify our frequency and pace and cadence for meeting. And that's going to also help us figure out if we do see a trend going one way or another, when do we go back to masks if we do relax mitigation strategies. I think this group has done a really good job in framing what we have to do. And we will come back together next week with really good ideas and an opportunity to shape a direction that I think everyone's looking forward to establishing. Okay. With that, I want to just thank you all for your time and your commitment to this. It is helping our kids stay safe. I think Caitlin can attest to the fact those numbers that she shared with you are amazingly good. And we should be proud of those numbers. And part of those numbers are because of the mitigation strategies we have put in place, and that's because of this group and the guidance. So until next week at 7 p.m., have a great rest of your evening and the rest of the week. We'll see you next week Tuesday.
Thanks, guys.